Nephritis, causes and treatment. Nephritis is an inflammation of the nephrons, which are part of the kidneys, also known as glomerulonephritis. It can affect kidney function, leading to changes in urine and urination habits and swelling in the hands, feet, and elsewhere. The kidneys are bean-shaped organs that filter the blood circulating the body to remove excess water and waste products from it. There are many types of nephritis with a range of causes. While some types occur suddenly, others develop as part of a chronic condition and require ongoing management. This video explores the types, causes, and symptoms of nephritis, as well as treatment options. Types. There are several different types of nephritis, including acute glomerulonephritis. This form of nephritis can develop suddenly after a severe infection such as strep throat, hepatitis, or HIV. Lupus and rarer disorders such as vasculitis and granulomatosis with polyangiitis can also lead to acute inflammation of the kidneys. A person with these conditions will require prompt medical attention during a flare-up to reduce kidney damage. Lupus nephritis. Lupus is an autoimmune disease, which means that the immune system mistakenly attacks healthy tissues in the body. Over half of all individuals with a lupus diagnosis eventually develop lupus nephritis. This occurs when the immune system attacks the kidney. The symptoms of lupus nephritis include foamy urine, high blood pressure, swelling of the legs, ankles, and feet. People may also notice symptoms in other parts of the body. These symptoms may include joint problems, fever, and rashes. The severity of lupus can vary between patients, although the disease sometimes goes into remission. The condition can become serious. It is vital for anyone experiencing symptoms of lupus nephritis to seek prompt medical attention to limit further kidney damage. Alport syndrome or hereditary nephritis. This disease can lead to kidney failure as well as vision and hearing problems. Alport syndrome is passed on in the genes, and it is usually more severe in men. Chronic glomerulonephritis. This form of nephritis develops slowly and causes few symptoms in its early stages. As with acute glomerulonephritis, this condition can cause severe kidney damage and kidney failure. It may run in families or develop after a sudden disease. IgA nephropathy. This is one of the more common forms of nephritis. It develops when IgA antibody deposits build up in the kidneys and cause inflammation. The immune system develops antibodies to combat harmful substances and organisms that enter the body. People with IgA nephropathy have defective IgA antibodies. Doctors do not often find IgA nephropathy in young people, as the early symptoms are easy to miss. People can treat this condition with blood pressure medications. Interstitial nephritis. Often developing very rapidly, this form of nephritis usually occurs due to infection or a particular medication. It affects the part of the kidney called the interstitium, which is a fluid-filled space. If a doctor takes the affected individual off the problematic medication quickly, a full recovery is possible in a few weeks. However, damage can sometimes accumulate to the point of kidney failure. Causes. There are many different causes of nephritis. In some cases, the cause may not be clear. Nephritis and kidney disease often seem to run in families, which suggests a possible genetic component. Some infections such as HIV and hepatitis B or C can also cause nephritis. In some cases, kidney damage can occur as a result of medications such as antibiotics. This damage can lead to nephritis. Taking too many pain relievers, non-steroidal anti-inflammatory drugs, or diuretics pills can also cause this condition. Risk factors. The most important risk factors for kidney disease are a family history of kidney disease, high blood pressure, diabetes, obesity, heart disease, an age of 60 years or more. Symptoms. The symptoms of nephritis are rarely severe in the early stages. The following signs may indicate that a person has this condition: changes in urinating habits, swelling anywhere in the body, especially the hands, feet, ankles, and face, changes in urine color, foamy urine, blood in the urine. When to see a doctor? Urine that contains blood will appear brown or pink. Anyone with this sign should visit a doctor as soon as possible. It is also best to seek medical attention for any other symptoms involving the urine. Early treatment can prevent permanent kidney damage and the more severe complications of nephritis. Treatment. The treatment for nephritis may vary according to the cause and type. Acute nephritis sometimes resolves without treatment. However, it usually requires medication and special procedures that remove excess fluids and dangerous proteins. Treating chronic nephritis typically involves regular kidney checkups and blood pressure monitoring. Doctors may prescribe water pills to control blood pressure and reduce any swelling. Medications that prevent the immune system from attacking the kidneys can also be beneficial in some cases. Doctors may also refer an individual with kidney infection to a dietitian who can advise them on what to eat to protect their kidneys. A suitable diet will typically be lower in protein, salt, and potassium. Prevention. Although it is not always possible to prevent nephritis, certain lifestyle practices can reduce the risk for many people. These practices include maintaining a healthy weight, quitting smoking, keeping blood pressure and blood sugar within healthy limits, exercising regularly. Eating a nutritious, balanced diet can also help protect kidney health.